For me, the decision, yes, I knew I wanted to be at Pitt. I've been an undergraduate here for 4 years, and I pursued the 4+1 BS MPH program, so that was a very big factor for me, and price was a factor. But looking across the different departments, I had a lot of interest, and I didn't know where those interests were going to take me. And when I look back at it, I know that health policy management was the perfect department for me, the right fit. But when I look across the different programs offered, I really wanted an experience that got me involved in the community. I think what's really fundamental are the professional development seminars, or the first semester and the second semester, that really gave me a lot of experience and taught me a lot about different fields of public health, and understanding, even for someone who wants to pursue medicine, how I can combine my interest in medicine and policy together. And being in a place like Pitt, it's in the school, and also being the city of Pittsburgh, we have a very diverse public health landscape. That is in the Allegheny Health Department, and UPMC and Allegheny Health Network. Those hospitals are very fundamental for providing patient care, but understanding that the patient population here is so diverse and public health disparities do exist. And how can you address those disparities, address those inequities to access of care, and really get involved from that standpoint? So from a school that has a great law school, who has a great medical school, a great public health school, as a public health student, I can work across all those schools, work with faculty who are really dedicated to my success. Dr. Bryce and Professor Hershey have been really fundamental in my advising and guiding me towards policy practicum applications in a clinical setting, and being able to have a plethora of those resources and have that advising and that close relationship with my advisors and my professors was a really big reason why I chose Pitt, and I'm very happy with my decision to be in health policy management. I think it's important to understand too within health policy management that you have Masters in Public Health and also MHA students. So I am in that Masters of Public Health cohort. It's a tight-knit cohort, 15, 16 students in that range. And for me, what that looked like, I was one of the youngest students in my cohort. Me and another were 2 4+1 students. And it was interesting to go into a program where there are a lot of students, maybe a year, 2, 3 years, even 4 years older than me. And I think what was really interesting in my program is the diverse experiences every student had. I've met several different people who have interests in insurance, who have interests in law, who have interests in policy analysis, who have interests in statistics. And being able to talk with those students and understand their diverse perspectives and their passions for that has only deepened my understanding of those fields, and also my ability to teach them about what I care about. I think it's important to go in with an open mind. That's very much easier said than done. As somebody who didn't know about the 4+1 program or even the School of Public Health graduate program until the middle of my junior year as an undergraduate, this was all very new to me, and I kind of just took a leap of faith. I think that the undergraduate college experience is meant to be self-exploratory, is meant to help you discover what you care about, but you also need to give yourself some grace in that you may have an interest in something, but there may also be something else you're really passionate about. And my experience in health policy management has been just that. I think it always comes down to relationships. It talks about relationships with the professors, relationships with the advisors, with the career staff, with Sarah Volmer, talking about different people who you can reach out to and not being afraid to ask those people. And I think that's a skill that's incredibly translatable to wherever you go, whether it be a job or further graduate school, like in my case. But being able to really talk to people and not be afraid to send that email, and just have those people that you know who are in your corner who want to see you succeed and want to see you develop. When I applied originally to the program, I came in with one idea of what I want to do, and it's completely evolved into something new and exciting, and without the support I've had, I wouldn't be able to be at that point.